everyone. My name is Dr. Rohit Arora. I'm a clinical director and head of neonatology at Apollo Cradle Hospital, Gurgaon. Today I'm going to talk about the newborn care, how to take care of your newly born baby, the bundle of joy. Before I'd like to tell you, I hope you're all safe and sound in this ongoing pandemic. I hope you take good care of yourself. It's your own immunity which is going to help you out. There are, as you all know probably, there's no much medicines available. So if you stay healthy, stay positive, you will probably sail through easily. Right, with that note, I'm going to talk about the newborn baby. So newborn baby, your bundle of joy is the way it's born. It can go very easy or sometimes it can be traumatic for the parents. A lot of parents don't know what to do, how things will roll in the hospital and when they go home. So I'm going to talk around that. If you have any queries, you may ask at any point. So care of newborn involved not just the neonatologist or the pediatrician, but of course the parents also. So they say it takes the whole village to raise a good child, right? So yes, it indeed involves a lot of people to bring up a good healthy child. So in the hospital setup, generally a lactational consultant, the obstetrician, your gynecologist, the pediatrician, the nursing staff, the physiotherapist, and of course the parents all have to work around taking care of the newborn baby. Then only the baby comes out well. So while you're in a hospital, when you will develop, so I'm talking about how things roll when you develop labor pains, when you're close to your due dates, how things will roll as to how the baby is going to come. There's a lot of confusion sometimes around that. So when you have that kind of labor pains, you'll probably call your gynecologist, he'll probably tell you to come to the hospital, get admitted. And then at the same time, pediatric team is told about the baby that your so-and-so baby's mother is here and the baby is about to be born. So accordingly, pediatric team prepare to receive the baby. So rest assured, if the mother is coming, the pediatric team is ready to receive the baby. They know beforehand that such and such baby is going to come. So a nurse and a doctor are always present to receive a baby, to attend all deliveries, whether it's a cesarean section or it's a normal delivery. So a whole team is available at that point of time. So we do our stuff when the baby is born, we clean up the baby, do the suctioning, etc., give some vaccinations which are mandatory to be given at birth. We wrap the baby nicely and hand over to the baby to the mother. In case it's a cesarean section, for some amount of time babies are brought to the NICU until the mother has recovered, and then immediately babies are transferred back to the mother's room. So that's how things roll when when the baby is about to be born. So while you are here in the hospital, the first thing you would want to do with the baby is to start feeding, right? Breastfeeding. I can't tell you enough about the breastfeeding. I can talk like for hours together about the benefits of breastfeeding to your newborn baby, right? So it's baby's birthright. Just remember that baby should receive mother's milk, and that's the first immunization, that's the first nutrition baby will get. Babies don't have much immunity when they are born. Immunity develops over a period of time and it takes around 2 months for the immunity to start to develop. And until then, babies are vulnerable to develop infections. They don't have their own immunity to fight against infections. So through the mother's milk, the immunity is transferred and then it helps babies to fight the infections. Then the nutrition, the brain growth, the baby's brain is developing really fast. So much so that all the brain, almost all adult brain size is achieved by 2 years of age. And human milk contains all the substances required to develop a good healthy brain. It's not just we want the baby's weight to increase, right? We want babies to be healthy, immunocompetent, having good IQ, requiring less of spectacles, not having allergies in future. So all these things are taken care of by providing breast milk, which cannot be provided through any kind of formula, no matter what kind of formula you use, no matter anywhere in the world, whichever formula, the best of the best are available, but they are not a match with mother's milk, right? Each mother's milk is different and is customized for their own babies. So a lot of benefits of giving mother's milk. So that's one. While you are here, there's a chance of developing jaundice in the first week of life. So when we visit while the baby is in the hospital, we look for jaundice, which can happen in almost 80% of the babies. However, only 10% or 10 to 15% of the babies require the jaundice reaches to a higher level, needing some kind of an intervention. Otherwise, in most cases, it subsides on its own. Simple precautions like feeding regularly, watching for the urine output, etc. All these help with the jaundice. So that you will be told. Now, also we perform what is called as the newborn screen of the baby, the metabolic screen of the baby, and that includes certain common conditions which are prevalent in the society, in our country, which may not be apparent at birth, but later on, once they are detected, then it might be too late. So it's good to test them early, and in case we find them to be there, it becomes easy to correct it beforehand, or otherwise it sometimes gets too late. So newborn screen, things like thyroid, right? Thyroid in newborns is getting common in North India, especially to the tune of 1 in 1,000 babies. So for every 1,000 babies, one baby will have thyroid disorders, means less amount of thyroid hormone in the body. So it's paramount to detect it early, so as to treat it at the earliest to avoid any delayed symptoms. So that's one. Another is before discharge, the hearing screen is also done. So that's also on the similar lines, that babies sometimes have subtle hearing changes which may not be picked up as early and can only be detected later on, but then it could be too late. Some things like delayed speech, for example, can present as so the hearing deficits can present as delayed speech. You don't want to reach up to that point, so you want to pick it up early before that, so as to correct it early and have a normal timely speech. So that also is done right at birth before the babies are discharged. Also, babies are given vaccinations like BCG, hepatitis B, and oral polio vaccines, which are given right at birth for those babies who come to NICU and have to stay for certain reasons. Those babies receive these vaccines at the time of discharge. And also, babies and the parents are handed over the vaccine card, which contains the details of these vaccines and when is the next vaccine due. That detail is also provided there. The date is mentioned. Things like cardiac screens or assessment of any possible heart disease, any eye issues, etc., are also carried out prior to discharge. Right? So these are the things which you will find some of us coming and doing on your baby and going away and telling you about their results. Also, you are given the next follow-up date, which is usually within 2 to 3 days of the discharge, primarily for the increase in jaundice, which needs to be looked at. As I mentioned, jaundice happens in almost all babies and it peaks at around 1 week. So, but we discharge the babies after 2, 3, 4 days maximum, right? So we need to look at the peak of jaundice, which happens at around 7 days. So for that, you need to visit your pediatrician and get the jaundice assessed again, and go from there. How much high it is, based on that you need to follow it up with your pediatrician. So these are the things which happen while you are in the hospital until you go home, and afterwards there are certain things which needs to be kept in mind while you are dealing with your babies, newborn babies. So again, most important, just your feeding. Please feel very committed, motivated towards giving your feed. most of your problems will be solved. A lot of them, I wouldn't say all of them, but a lot of them problems will be solved by giving your baby your own milk. You're providing good immunity to your child. We see it all the time in our OPDs. Those babies who are mother fed for the first year or so, they generally don't get sick, don't develop allergies, asthma, wheezing. Whereas the babies who are primarily formula fed, they develop all these things quite often. So breastfeeding needs to be continued when you go home. Then stuff like applying kajal in the eyes, applying stuff on the umbilical cord, or expressing milk from the chest of the baby. All these are to be disallowed, should not be allowed, prohibited. So they only harm your child. These are certain practices which are carried out in certain parts of the country but needs to be discouraged. They should not be carried out. They sometimes can land your baby in a lot of trouble. We get sometimes babies with chest infections because the parents are expressing milk from the chest, thinking that it's a witch's milk. There's some swelling, so they want to get rid of it, but that doesn't happen. It generally gets corrected on its own in few weeks to few months time. You don't need to do anything at all, right? So that keeping that in mind. Now newborn babies get a lot of rash on the body, small pimples like rash on the front, especially on the trunk, the face, the neck region, and then these are normal newborn rash, neonatal acne you can call it. They also subside on their own, doesn't need to be applied anything. Don't apply any powder, cream, lotion, oil to get rid of it. In fact, if anything, they will exacerbate these rashes. So this also to be kept in mind, that rash is a normal phenomena to be left alone and it goes away on its own. Diaper area, so poop counts. Okay, let's come to the common queries which I get in my practice. How would I know that my baby is feeding well, right? This is a common query parents ask us. So for you to know, of course, you cannot quantify how much breast milk baby is ingesting, right? So how would you know? You can know by checking the number of times baby is passing urine. So urine is your benchmark of baby's overall health, not the stool, not the vomiting or any other part, but how much time baby is feeding, but the urine output. If baby is passing urine well 5, 7, 8 times per day, that means baby is getting enough milk, right? So that you can keep a check of. If urine output will give you a good idea of how much baby is feeding. Stool pattern is variable all throughout the first year of life. You'll see all the rainbow colors, you'll see all kind of consistencies. Don't worry about it. As long as there's no blood in it, as long as baby is otherwise well, stool pattern has got no pattern. Baby can pass 10 times, 15 times per day. Baby may not pass even once in 7 days. All can be normal patterns for your baby, as long as urine output is okay and other parameters of the baby is okay, like sleeping. Baby is sleeping all right, feeding all right, right? There's no tummy distension per se. So all these parameters to be kept in mind, and then stool frequency you can safely ignore. So that's about urine and stool. What else we can discuss? I think I'm getting a few questions. I'm going to take that. हेलो सर, नमस्ते। मेरा नाम सुमित, मेरे बच्चे की उम्र 5 साल है। जो अभी ये महामारी चल रही है कोरोना को, अगर इस दौरान थोड़ा बहुत खांसी, सर्दी, जुकाम, बुखार हो और डॉक्टर देखने के लिए मना करे तो हमें क्या करना चाहिए? Okay, good question, practical question. So yes, ongoing pandemic is hard on everybody, including doctors. Having said that, everybody is trying their best these days. OPDs, most of them has opened up, so you can go to a close by doctor if you prefer. I'd recommend to take an appointment prior to going. So take an appointment before you go. So that there's no rush and there's no wait time. You can avoid the rush times, and if there's a fever, generally hospitals have fever clinics separate from other vaccine clinics so that there's no mixing of people. And in this winter weather, or rather monsoon weather, the flu is also rising. So COVID as well as flu both can cause fever, so any distinction has to be made. So also online consults are being offered by doctors now, so you can opt for an online consult to begin with, and keeping in mind that not everything can be diagnosed and prescribed online. Sometimes you need to see the child before you can reach a diagnosis. But to begin with, you can always try an online consult. I hope you have answered your query. Okay, what extra precautions should we take for newborns during this COVID situation? Okay, good questions. So all practical ones. Extra precaution for the newborn period would be make sure you sanitize, the usual precautions you are following for yourself. Make sure you sanitize your hands when you go back home, wash your face, change your clothes. If possible, take a bath if you're moving in and out of the house regularly. So do all this before you go and touch your baby. Try and avoiding touching the face area of the baby. Try and avoid kissing the baby on the cheeks. All these are the areas from where infection is transferred. So these are the precautions. Also breastfeeding again comes into play. So mother feeding will again protect the baby, and in case somebody happens to be there, a COVID positive in the family, or suspect the mother's immunity being transferred to the mother through breast milk, will help with handling the situation well for the newborn baby. Alright, so I guess those are the questions at this point. I'm going to move forward. I'm going to talk a little bit about the vaccination again. So after the birth vaccines, you will find that you will have to visit the hospital on a regular basis to get the regular shots done. Now, vaccines are becoming more and more the first line defense for the babies. Like this pandemic, if it has anything taught us, that immunization is extremely important, right? COVID vaccine everybody is looking after. Why? Because that's probably the only thing which is going to work. How do they work? They boost your immunity and makes the immunity work against the virus or bacteria which is going to harm your body, right? So again, it's about your immunity only. So vaccines work exactly like that. So they give you a passive infection, surrogate infection in the body, and that infection, although doesn't produce much symptoms, very mild symptoms sometimes, but then it is able to prime your immune system, and in case of eventuality, in case a bacteria or virus invades your body, it attacks it and is able to help prevent the severe symptoms. So that's how all vaccines work. So vaccination, please be very committed. Think of it as an investment, not as a cost-bearing thing. So it saves you, even if one of these diseases happens and you have to get hospitalized, you have to spend 100 times at least more of what you will spend on that vaccine. And plus the trauma of getting hospitalized and getting blood removed for testing, etc. So vaccination should be done. It's again babies' rights to get their vaccine shots, and almost all vaccines, although some are mentioned as optional and mandatory, but that's to do because of the logistics of the government machineries, that government cannot afford a lot of vaccines to be given to millions of people. But as far as if you can afford, if you have means to purchase those, you should get it done for your child. So you'll have, these are called as well baby visits. You have to come for them and discuss the baby's growth and get those shots, and if any issues, you can again bring them written down and then discuss with your pediatrician. Breastfeeding should be continued for 6 months. After that, your pediatrician will advise you to start semi-solid foods, and they also needs to be started very slowly based on baby's acceptance. So something called as baby-led feeding. So that also needs to be discussed in details at one of these baby visits. All right, so that's about vaccination. What else? Okay. Okay. Coming back to the newborn period, I was just going through my notes as to what else I should talk. So there's a common question which comes up as to what kind of diapers we should be using for the babies, right? So there are cloth diapers and there are disposable ones, ready to use diapers available. So both are good, both have their advantages and disadvantages. The cloth ones are made of cotton, they don't cause any allergy, they are skin friendly, but they leak a lot, right? The disposable ones, they don't leak, they keep the baby dry, but they can cause allergies and they're not good for environment, right? They're use and throw. So which ones to use? If you ask me, ideally, yes, it should be cloth one. But if you're a new parent, you don't want to be, you don't want your child to be waking up just because baby becomes wet. So you have one thing less in your mind in the initial part that diaper will take care of. So I would say use both to begin with, and gradually switch to cloth nappies or diapers as you are getting more and more comfortable with your baby around. So that's about diapers. Let me see. Okay, oil massage. About the oil massage, in the initial part, which recommend use of coconut oil, olive oil, or sesame seed oil, right? Tel ka tel. All these three oils can be used for the massage of the baby once the cord stump has fallen and the base has dried enough. So it takes around 2 weeks or so. So everything. So you can start bathing as well as oil massage at around 2 weeks of age. All three kinds of oils are okay, but I personally prefer coconut oil. Simply because in my experience I've seen most babies respond really well, there's less chance of allergies, and also it's an MCT oil, so it helps in it gets absorbed also, and sometimes provide calories to the baby as well. So oil massage, some babies really enjoy it. It should be done. It's good for their muscles and bones, and they sleep also better when the massages are done. So yes, and it's a time when mother and baby really bond together. Brain is growing so fast in early life that an eye-to-eye contact between mother and the baby is highly essential, and such kind of activities provide these opportunities, right? So baby and mother, while they're feeding, while mother is giving bath, oil massage, etc., all these opportunities are important for the baby's growth and development. So oil massage should be done regularly. So babies, a couple more points and then I think I'll wind up. Babies don't sleep at night most of the times to begin with, right? Most mothers must have experienced this. The reason is when the baby is inside mom, when the baby is in fetus form inside the womb, they were sleeping when the mother is upright and walking during the daytime. When the mother is lying down and sleeping, they used to wake up and move around in the water. Unfortunately, the same cycle continues once they are born. So this cycle takes sometimes even 6 months to change, if you're lucky. Boys tend to change later than girls sometimes. So keep that in mind, that for the day is like night for them. They sleep much longer and harder to wake up. Night is like day for them, if at all they sleep, if at all. They sleep for short durations and then wake up early and then demand feed. Right? So there's no point struggling with this situation. No point trying to change baby's cycle. It won't happen. You won't succeed. Instead, change your cycle. Try to take a nap during the day, and at the night when they're awake, they'll keep you awake. So that you have to deal with for at least I'd say 5-6 months. After that, it generally changes, and then maybe have better nights. So that's about sleep cycle. There are a few questions coming up. If any vaccine got delayed or is it harmful? Okay, good question. Which is quite common in this era because of the COVID pandemic, people are not showing up for the vaccination, which can actually harm the baby. Harm in the sense that it can actually nullify the effect of previous vaccinations which have been given if you don't do all the vaccine in a timely manner. Some vaccines are really important, though they should not be missed. Some which can be delayed, but they need to be told to you by your pediatrician. So you have to check with your pediatrician close to your due date whether it's really essential or not. Or sometimes what we can do is we can club more than one vaccine in the same setting so that the number of visits can be reduced. So this can be done, but please make sure that vaccinations are done on a timely manner. All right, I guess I'll say goodbye to all of you. Take good care of yourself, be positive, stay in positive frame of mind during these difficult times. Take good care of your kids. Please remember that your kids are also struggling in this pandemic. They are supposed to be moving out in the parks, playing around, right? Not watching television or not doing anything. So they are also struggling. So keep that in mind when you're dealing with your kids. Thank you very much.